my name is Sadia Sherman, and I'm Executive Director of the Task Force on Racial Inclusion and Equity. This past year has been tough, with the loss of loved ones, jobs, businesses, homes, and livelihoods. Many of us have experienced feelings of uncertainty, sadness, fear, and anxiety. The weight of it all has been a lot, but thankfully there is a sign of hope with vaccine distribution underway. Vaccination is a personal choice that has community-wide impacts. The decision to be vaccinated is based on trust and confidence in the vaccine. Given our nation's history of systemic racism and our individual lived experiences, it is not unusual for some, particularly in communities that have been marginalized, to have distrust of government. Add to this a complex range of factors such as misinformation and disinvestment in communities of color, and it's easy to understand why earning trust and building confidence is central to having a successful vaccination effort. In April of last year, Mayor Bill de Blasio launched the city's Task Force on Racial Inclusion and Equity in response to the racial disparities that were laid bare throughout the pandemic. The task force is comprised of city agency leaders, mostly of color, who have been charged with identifying programs, strategies, policies, and other interventions that will ensure communities of color and the neighborhoods hardest hit by the pandemic come back stronger. Many of us live, work, and come from these impacted communities. Since launching, the task force has announced a number of new initiatives ranging from new localized healthcare, mental health resources, to policies and services that will strengthen MWBEs, to the acceleration of broadband access to NYCHA and other impacted communities. Most recently, the task force announced Tree Neighborhoods, a new initiative that will support community-led coalitions across the 33 most impacted neighborhoods. These coalitions will help increase vaccine literacy while also identifying a range of community needs and priorities that will help us ensure an equitable recovery. The task force has been focused on building vaccine trustworthiness and ensuring equity is centered in our overall approach. The city has taken proactive steps to ensure that all New Yorkers have access to factual and timely vaccine information. Through the Vaccine for All campaign, the Department of Health is creating tailored messaging in multiple languages and engaging directly with communities through town halls and community conversations and other on-the-ground outreach. The city is also centering the expertise and the knowledge of community partners and leaders in all of our strategies to build trust, as well as humanize the vaccine experience. To slow the spread of COVID-19, the most important thing everyone can do is get vaccinated. My advice is that when the vaccine is available to you, take it and protect yourself. And while we see that hope is on the horizon, we know that a return to normal is not good enough. It will take unprecedented collaboration, partnership, and collective healing for us to rebuild and recover from the pandemic and also come back as a stronger and more unified New York City. This new series, Reimagining Public Health for New York City, will help spark new ideas for what it means to have a city that is rooted in the values of racial justice, equity, and community power. I applaud the Department of Health and all the partners who have made this series possible for helping us to reimagine and build the city we know we can be. Thank you.
Good evening, New York City. Thank you. My name is Abby Dobson, and I am honored to be here and to be part of this important conversation and launch of the Reimagining Public Health for NYC series. Thank you to the New York City Health Department, the amazing panelists, Dr. Easterling and Dr. Morse, for sharing this space and for welcoming in song and music. On behalf of the Resistance Revival Chorus, I am pleased to open tonight with a song that I wrote entitled Say Her Name. 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 Shelley Fry, Eleanor Bumpers, Natasha McKenna, Alberta Sproul, Michelle Cousseau, Corinne Gaines, Chantel Davis, Kayla Moore, Maya Hall, India Kager, India Beatty, Tanisha Anderson, Deborah Danner, Brianna Taylor, Rokia Boyd, Ayanna Stanley Jones. Say her name, for all the names I cannot say. Say their names, for all the names I'll never know. Say their names. Black girls matter. Say their names. Black women matter. Facing the rising sun of the new day begun. Let us march on. Let us march on till victory is won. Say her name. 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 Say her name.
Good evening, everyone. Thank you so much, Abby, for that incredible offering, your voice, and for your call to justice. And thank you also to the Resistance Revival Choir. This tribute to Black women lost to violence is so powerful as we open this event this evening, which happens to be the very last day of Women's History Month. Today is also the day of trans visibility. And I'm thankful that we have this space to honor these traditions and these communities. So welcome everyone to the first conversation in this series. This is a series that's going to support and foster conversations and dialogue about important topics facing public health in New York City during COVID-19. And welcome to all the panelists, the incredible panelists who are joining us. Good evening again. We're excited for this conversation. My name is Dr. Michelle Morse. I'm the Chief Medical Officer and Deputy Commissioner for the Center for Health Equity and Community Wellness at the New York City Health Department. Before we start, I just want to pause and take a deep breath as we open the conversation, recognizing the trauma and the grief that we're all experiencing into tonight's conversation, the same month that we recognize a year of COVID-19's toll in New York City. And we stand in solidarity with Atlanta, with Boulder, and with other communities who lost lives at the hands of white supremacists. Just this week in New York City, we witnessed an attack on an Asian American woman in New York City while bystanders stood by. And I think all of us are grieving for the Asian American and Pacific Islander community and continue to listen to what these communities need right now. So tonight, we want to get directly into the conversation. On the screen, we're going to be sharing some images right now from the I Still Believe in Our City project by artist Amanda. She created this project as a public artist in residence at the New York City Commission of Health Human Rights in partnership with the New York City Department of Cultural Affairs this past year. We're grateful for these images that are around the city and are all of the work being done by the Commission on Human Rights, community partners, advocacy organizations, and cultural strategists to stop anti-Asian discrimination and racist attacks. So let's go ahead and get into the conversation with the incredible panelists that we have with us this evening. I want to start by just grounding us with some words that help to hopefully set up the conversation tonight. First, I want to start by introducing Dr. Michaela Martinez. Dr. Martinez is an infectious disease ecologist and assistant professor at environmental health sciences at Columbia University, who's working on vaccination policy, as well as how environmental factors interact with infectious disease. We also have the incredible Laura Stiles, who's with us this evening. She's the co-host of Ebro in the Morning on Hot 97. She has over 12 years of history in the radio industry. She's a California native, and she joined the Hot 97 morning show in 2013 as producer and co-host. Next up, we have Dr. L. Tony Lewis. Dr. Lewis is the founder of Liberation Health Strategies, which focuses on community, national, and global holistic strategies for health justice. She's a family physician and geriatrician and is credentialed in Kemetic Yoga. She serves on various boards and leadership committees for health and social justice. Next up, we have Crystal Echohawk. Crystal's the founder and executive director of Illuminative, the first and only national Native-led organization focused on changing the narrative about Native peoples on a mass scale. She was recently selected for People Magazine 2021 Women Changing the World, and she's working on several national campaigns and initiatives to build vaccine confidence for Native peoples. And last but certainly not least, we have Dr. Joya Creer-Perry, who's the founder and president of the National Birth Equity Collaborative. She's a physician, a policy expert, a thought leader, an advocate for transformational justice. And in 2020, Dr. Creer-Perry was honored by USA Today in its Women of the Century series and was featured on ABC Nightlines, Hear Her Voice. A huge round of applause to our incredible panelists who are going to help us work through what are really challenging issues, but also they're going to help us to think about where we go from here. And again, just honored to get to both honor the end of Women's History Month, Trans Visibility Day, and the opportunity for us as women to reshape and rethink and reimagine public health for New York City in this very difficult time. So just by way of grounding us before we jump into the conversation this evening, and thanks again to everyone who's joined online. We see you, we feel you, we appreciate your presence with us. But it's so important to recognize and to ground ourselves in remembering kind of where we are in this particular moment in history. It's really, really important, I think, that we highlight and remember that this week is the beginning of the murder trial for George Floyd's murder. I think it's also really important that we think about the future and think about what reimagining a future defined by racial justice, community power, and equity in public health could mean, what it could mean for the city, what it could mean for the country and for the world. So I'm grateful for the opportunity to speak with these incredible women leaders, to learn and to share and to dream big about what the future looks like. So we're going to focus our collective thoughts and strategies on building vaccine trustworthiness. We're looking at the conversation about what drives mistrust and how important it is for institutions to demonstrate trustworthiness. At the same time, we can't hide from this country's history and the history of racist practices in public health and medicine, as well as the current experiences of racism and the experiences that lead to mistrust, which is a completely appropriate response considering past and current harm. We're here in New York City, so I don't have to tell you how important it was for the statue of Marion Sims to be taken down, or what it means to Black and Brown communities to hear that even as recently as 2016, that some health workers think that Black people have thicker skin, or what it means to see headlines about the rate of mortality for our babies when they have Black neonatologists as opposed to white neonatologists. As we know, just in the first 6 months of the COVID pandemic, life expectancy dropped by 2.7 years for Black Americans and 1.9 years for Latinx Americans, which is the most dramatic change in life expectancy in decades. So we know that the vaccine, we're all absolutely excited, is available finally. And at the same time, we know that the vaccine is not going to cure structural racism or racial capitalism or gender oppression or ableism, and that we need social equity in addition to vaccine equity for us to reimagine public health and dream a new future. So we have to be constantly addressing these parallel pandemics of both social inequity and COVID-19 in order for us to see our way out of this crisis. We also know that BIPOC communities and leaders should be leading strategies for vaccine equity, and that's another reason why we're so excited to be in conversation with the panelists this evening. They're going to describe to us and answer some questions about how we can do that better. And it's really incredible, again, to just be here this evening with women who are change agents, who are constantly disrupting the narratives of injustice, challenging conventional methodologies, and really highlighting the importance of reckoning, restoration, and healing. So with that, I'm going to kick it off with the first question to Dr. Michaela Martinez. And Dr. Martinez, you know, the equitable access to the vaccine is really important, obviously, for recovery from COVID and for addressing the parallel pandemics. But we know that social inequity is one of the main drivers of inequities in vaccine. So I'm hoping you can share a little bit with us about how environmental racism has shaped the vaccine response and how we can fight environmental racism and structural racism for a more equitable recovery for New York City.
Yep. Thank you for that question, and thanks for having me. Well, when thinking about environmental racism and COVID-19, when we in New York City is really unfortunately, a great example of how environmental racism and COVID really came head to head, because what you have are communities of color that bear the brunt of environmental exposures and pollutants both inside and outside of their home that can set them up with higher rates of pre-existing conditions. So, think of, for instance, Northern Manhattan or the Bronx, which are places where we have concentrations of air pollution, of industrial pollution. You have essentially the brunt of, these communities have borne the brunt of everything that is environmentally hazardous for the city. And also these communities are healthy food deserts. If you look at the bodega to grocery store ratio in Mott Haven or Harlem versus the Upper West Side, it's astonishing how the environment that people experience both within their home and outside in their communities, it's impacting health in a really strong way, even when neighborhoods can be right next to each other. And so when we look at chronic diseases, so things like heart disease, diabetes, asthma, even though there's been this narrative for decades that these are diseases of behavior, these are actually really diseases of environment. And so this is the way that environmental racism has essentially set up particular communities to be more vulnerable. Now, these communities, there's been a discussion nationally that communities of color, because there are such higher mortality rates, Black and Latino New Yorkers 2 times more likely to die of COVID than our white counterparts. And so these communities are, because they're so vulnerable, should have access and priority to vaccination. And there have been campaigns. I know the Department of Health has been working on an equitable vaccine response, but if you actually look to date at the data for first and second dose COVID vaccination, they follow the same lines as all of these other elements of environmental racism. Once you get up to 110th Street at the top of the park and you start hitting Northern Manhattan, so Harlem, the Heights, Inwood, the Bronx, you see that the vaccine coverage is quite strikingly lower than some of the higher SES communities. And so what I would say is that, when we think about what communities to prioritize, it's really important to think about how environmental racism has set communities up to be vulnerable. And then we need to respond to that with equitable vaccination, but not just say we're going to be equitable, but like actually do it in proportion to the vulnerability.
Thank you for that. Thank you for that. I think it's just incredibly clear the way that you described that, there's concentrated vulnerability and patterns of social inequity that have created predictable patterns, unfortunately, for both COVID infection as well as distribution of the vaccine. And I couldn't agree more that we have to execute, we have to operationalize equity, not just talk about it. So thank you for really highlighting that. I want to turn next to Laura Stiles, and thank you again for being with us. I am sure lots of New Yorkers who are tuning in are seeing you and excited to be able to reconnect with you in this way, not during the morning show, but here on the panel. So thanks for being with us. I wanted to ask you, Laura, because you've really got your ear to the ground as a host of the Hot 97 morning show. What are you hearing from the community on the show about how community is seeing the vaccine, what some of the concerns are? Let us know what you're hearing.
Well, first of all, I want to say what a pleasure to be on a panel with all of you incredible women. It's truly an honor for me, and to see these beautiful faces that represent so many of us. And it's needed. We need more women of color having these type of panels, because I myself know I love to see myself in the information that I'm seeking, right? And that's one thing that look, we have a lot of fun on the morning show. Gossip, entertainment, but we are very community focused. We talk about the real issues that are happening in our community. And sometimes people make fun of us, call us nerds because we talk about nutrition, you know what I mean? But it's the reality to Michaela's point, we talk about the food deserts. We talk about, things that affect us. And it's crazy because our audience is everyday people, during the height of COVID, we would have people call us who got infected. We had so many first responders. We had some incredibly emotional calls from nurses that were, that had seen the worst, had been under tons of stress. We have doctors call in, and the number one thing I will tell you that people tell us that they just don't trust, the vaccine. And why? It's because of all the misinformation that's out there. There's so much misinformation that's floating around the internet. And I hate that people don't really know where to look for the actual facts and the research, right? And Doctor, you said it before, our country has a history, excuse me, a horrible history of racism. And I mean, we just came from a horrible administration, you know what I mean? So people were definitely like just not trusting the government whatsoever. So there's so many questions about, is this okay for me? This was rushed. I think I should wait. And I'll be honest with you guys. I was one person that I was like, you know what? I'm going to wait a little bit and see what happens. I want to see what happens. Maybe I'll wait a year. But it took me to have conversations with physicians, with my friends who are in the medical field. I took it upon myself to do my research, and I decided that getting vaccinated is right for me. I'm actually getting my first dose on tomorrow. And I decided I needed to protect myself because I'm sure, like a lot of you guys, I've had a lot of people that were infected. A lot of people pushed through, but I also lost a lot of people. And I would say the number one thing, guys, is the misinformation that's floating around. And that's the one thing that I want us to tackle more than ever.
Thank you for that. Thank you for just your honest, direct response for your personal story, Laura, also about you getting the vaccine tomorrow, but also just for transmitting what you're hearing on the show to this community. And I'm excited because we do have some amazing experts on this panel who can, as questions come in, and I hope folks are peppering the online form with questions, because we're hoping to get to as many questions as we can a little bit later in the conversation. So please submit them. But thank you, Laura, for really describing again kind of what you're hearing and how we can, again, be lifting up good, reliable sources of information about the vaccine, because it's all about each person making a decision for themselves, right? It's like, what are the risks? What are the benefits? What are the alternatives? And what information do you need to be able to make that decision for yourself? So thank you for really lifting that up. I appreciate it. I'm going to turn next to Dr. L. Tony Lewis with a question. And Dr. Lewis, again, just honored to be a part of this panel and to be moderating. I wanted to ask you if you could tell us a little bit about what you're hearing on how communities are processing harm from COVID, harm from racism, and how communities are also centering resilience. And I want to also just kind of add a part B to that question for you, because I've heard you speak so powerfully and eloquently about ableism and how ableism is so embedded in our health systems oftentimes, and we don't even see it. And as a doctor, I'll tell you, from my medical school training, it was not a part of my training. It might have been a part of yours, Dr. Lewis, but it really wasn't a part of mine. So can you tell us just a little bit about what you're hearing about how communities are processing harm, and also how we can, find methods for resilience and find methods for approaching what is deeply embedded.
Hello, can you hear me?
Yes, we got you.
Excellent. Yeah, it froze for a second. So first of all, I will add to the chorus of yay for being here with all these beautiful women on this particular day. And I think it's always good to echo again that this is International Transgender Visibility Day, because being invisible, being not seen and not heard causes so much harm, whether you're a Black woman, transgender, soul, family, all of the things. And so when I think about this question about how are people processing harm, my first thought was, which one?
But what harm are we talking about? We're talking about the racism harm. We're talking about the protest harm. We're talking about the kind of trying to figure out how to juggle all of the things harm, and I was thinking about what Laura was saying about how essential workers, home care workers, people in the Department of Health, people in, various places who have never stopped on this are just experiencing wounds in just a whole different way. So those tears that were being called in March of last year have been like every month, and now as we get ready to get to that we're on that anniversary timeline now. The first time you saw a case, the first time we had to stay at home, the first time, the seasons were back to summer and we're not doing the things again, like there's all of these things coming up. And so, in kind of three buckets, how are people processing harm? Well, if you look like me, we had some harm that was going on prior to, this pandemic, and this just kind of heaped on another layer of things. And so I would say the things that I've heard most often in the last, and let's just say 48 hours, are exhausted, overwhelmed, but also on fire. I want to shout out Abby Dobson for bringing that power in her voice, because there are a lot of folks who are like in this space of kind of racial reckoning, of figuring out how we do something different, of disruption, that are taking that energy of like the grief, the loss of like, our new ancestors, the injustice that we've seen, all of those different things, and channeling it into solutions, whether it's through art, creativity, investing in our dopeness, calling out the disruptions, whatever it is. There's a deep fire, I'm in Bed-Stuy, Brooklyn, that's just kind of people trying to do all the things to make sure we don't just get out of this like alive, but we get out of this like well and liberated. And so to your second question about, how do we deal with like the ableism and racism and all of these different things, it's just, all the isms, my goodness, I feel like I want to punt right now to my friend, Dr. Joy, who says, you're like, look, it's not racist racism, like all of these things. It's unfortunate that like so many of us who have been in this field or looking at this or just loving our people for decades, like could have predicted this. Like there's no surprises here in terms of how bad it's been I see the nods from my panelists, and it's that kind of thing where in order to disrupt that thing that we know is true, that wants us not to see us, not to feel us, not to care for us, care as a verb, not just an emotion and a verb and an investment, disrupt that by actually seeing our brilliance and our dopeness. And that, no matter what your ability, how you move through the world, how you talk, how you love, how you breathe, how you dance, like it all makes New York beautiful. And so I think it's imperative on all of us to shine that light on those dark spaces that keep us harmed, and really start flipping that to like just moving us towards liberation and just joy.
Absolutely. Thank you for that. Thank you for that. And I couldn't agree more. I think that's exactly what we're here to do tonight, right? It's to put the spotlight on the darkness, and then also think about how we move our way into recovery, how we reimagine what public health could mean for the city, how we reimagine what the role of women of color, like all of us on this panel, could be in that reimagining. So thank you. Thank you for setting that up so beautifully. I want to turn next to Crystal Echo Hawk with another question. So I really want to first say thank you again for all of your work. It's been just so inspiring to hear about the listening tour that you've been doing across the whole entire nation with Indigenous communities, and just know that that work is not easy. It is not easy to slow down and listen. It is unfortunately rare that we do it, especially in the world of public health. And so just thank you for your work. And along those lines, in your work hosting these listening sessions across the country, what are some of the things that you've learned about what it's going to take to build back trustworthiness? And again, recognizing that mistrust of public health, medicine is a natural, historical, and current harm. And so knowing that, What have you heard from communities across the nation, Indigenous communities across the nation in your listening sessions about what it would take, what we need to do to be trustworthy?
Yeah, absolutely. Well, thank you so much, first and foremost, for having me here. And this is already such a beautiful experience to be surrounded by all these powerful women of color. And too many times when we get on public health, it's usually a sea of where there's no color, right? And a lot of people talking from a vantage point where they don't see our communities. And so I just want to say this is a blessing to be here in this circle with you ladies tonight. It was really important. We learned early on in the pandemic, that invisibility can be a matter of life or death, right? And in this country, Indigenous peoples are largely invisible, right? And this is not oppression Olympics by any means, where all of our communities really face, a variety of challenges where our voices, our experiences are not seen or heard or valued. But, particularly for Indigenous peoples, it's one of the greatest threats is that 80% of Americans know nothing about us, and a significant portion aren't even sure if we exist. And so we learned early on in the pandemic that, we weren't even being kind of in the calculations around the federal government's response. So that's been the number one lesson is our ability to continuously shine a light on our community, but also do a lot of listening. And one of the things that we found as we began to do a lot of our research starting last summer is that our folks have a high degree of distrust in the federal government. I mean, we're talking high 90s, over 95% of our respondents from a national survey we did of over 6,400 Native people found about 95% don't trust the government. And so as we've come into this moment around the vaccine and the rollout, that mistrust is still playing out pretty seriously. And so it's real. And we have horrible histories, as so many of our other relatives from other communities, right, about where we've been subject to experiments by the federal government and by people that are supposed to be trusted in medicine and public health. So overcoming those fears, that distrust, and that also, I think, as with so many other populations, about what are the long-term ramifications of the vaccine. A lot of concerns, by people who are sort of in that age of when they're thinking about having more children, to our elders wondering if Alzheimer's is going to, is that a risk? And just, a lot of, I think, these questions that are coming up amongst other communities. The one thing we have really heard, though, from people who have either gotten vaccinated or are getting ready to, is the number one motivation is community. And I think that I found that just not surprising, but it was so beautiful, right? And that is the biggest motivator of thinking about, I've got to take care of our elders. We have to protect our elders because they carry our culture, our teaching, so much of our language oftentimes. Thinking about, just protecting our traditional lifeways and our future. Being able to participate in ceremony, to be able to return to ceremony, to be able to return to our dances and those ways of life in which community is everything is the number one factor. We're also hearing that, oftentimes that, sort of the younger generations that have children are telling the elders, you don't get to come visit the grandkids until you get vaccinated. And so again, just that central motivation of community is really important. And that we need to be also really mindful that as people have very real fears, whether it's distrust in the government, distrust of medical providers, which racism has been a major factor, particularly for our people living on reservations, and that oftentimes medical providers are off reservation and non-native. Those are real issues. And we can't shame people if they're hesitant to get that vaccine. We need to showcase people's vaccine journeys about their sort of decision-making to getting to the vaccine. And one of the biggest things that we've heard is that as we do education on the vaccine, it needs to be Native health professionals and doctors, people from our community that we are hearing that from. I mean, we're hearing great things. People trust Dr. Fauci. We hear that a lot, but they want to hear it from our own people, really delivering those messages. And the final thing I would say is that, people also, I think what we're learning as we build our campaign is that we need a campaign that can also say, look, the vaccine is one really important solution to defeating this pandemic, but we need to continue to mask up. We've got to social distance. We've got to wash our hands. We got to do all the things that we've been hearing about. And because our people, are totally convinced that that's the only solution. So we've got a lot of work to do. Unfortunately, Indian country is sort of killing it in terms of vaccine distribution. In fact, here in Oklahoma, where I'm living right now and coming to, tribes here have opened up their vaccination programs to everyone in Oklahoma, which is great. It says a lot about our efficiency of our Indian healthcare system and getting vaccines out, but it tells me that we are facing very high numbers of vaccine hesitancy in our own communities. So we have a lot of work to do.
Thank you so much for that. I so many pearls in there. And again, just like it shows us the gold that comes from actually pausing and listening, right? And listening to community, making sure that that is what guides us in our strategies, and really appreciate also you lifting up that we can't have vaccine tunnel vision, right? The vaccine alone is not going to be the only thing that gets us out of this pandemic. So thank you for highlighting that. Really, really appreciate it. And we'll get more into that very soon. Again, we're coming up on the Q&A soon, not immediately, but very soon. So submit your questions online, please. We want to be in dialogue with all of you who are tuning in, and we appreciate you being here. The next question in this first round of questions is going to go for Dr. Joya Creer-Perry. And Dr. Creer-Perry, before I turn to you with this specific question, we do want to show a short video from this new initiative. It's called The Conversation Between Us About Us, and it's a campaign by Black healthcare workers for Black people about COVID-19 vaccines. It was developed in partnership between the Kaiser Family Foundation and the Black Coalition Against COVID. So let's take a look at the video, and then I'll ask Dr. Creer-Perry the question.
No, there's no reason to believe that the vaccine impacts fertility. In fact, we're looking at studies that COVID might impact fertility in the future. A lot of young people do care about having babies in the future, right? So if we can really articulate that we are not sure that COVID doesn't impact your ability to make a baby in the future, perhaps you should take the vaccine for your own future fertility.
Thank you for that. Thank you for that video. And that's just a short clip from what is a very extensive series with several Black doctors from across the country. So thanks for sharing that. And building on that, building on your work as a leading voice for maternal health and ending the racial disparities in maternal health outcomes in this country, you have obviously delved deeply into questions about how systems of oppression lead to worse outcomes for Black women, women of color all across this country. So can you tell us, Dr. Joya, a little bit about what you have learned from your experiences working on maternal health and maternal health equity that you think we need to be applying and thinking about as we're building trustworthiness for the COVID vaccine?
Well, first, like everyone else, I want to thank you, Dr. Morris, for inviting me. And I miss you here in DC, but I'm excited to see you there in New York with my colleagues and building on the work that we've been doing for years with folks like Torian and Alzin at the health department. And so I'm just excited to be here. Will y'all hear me? Was I frozen for a second? I'm back. Okay, we're back. Okay, great. All right, so I could really talk a little bit about not only the experience around the world, around the United States, around what we learned from the maternal mortality work, but really what we've learned in New York City, what we've learned very deeply by working with the community action groups and working with communities there, that shaming and blaming communities is not how you build trust. Right? If you want to get folks to participate in their health, think about how we have historically practiced public health. There's a lot around blaming folks, blaming people about how they sleep with their babies, or blaming people around how if they're co-sleeping or not, if they're doing care, going to the doctor or not, and that narrative that is something wrong with us and that we are not acknowledging all the barriers for us to be able to be healthy and all the barriers for us to thrive. That is, communities know that. So that mistrust across all the communities of color. I was thinking about when all of my fellow colleagues were talking about the government, there's very few people in the community of color who would ever just say, yes, I believe, I trust the government. It's just very difficult for us because we all have stories and narratives around how the government has done things like eugenics, tying people's tubes when they weren't wanting to do that. And so it's hard to believe that now they're wanting to have to be supportive. And so it's just important for us to really rethink when we're messaging and talking to communities about the importance of getting the vaccine, that any moment that you find yourself blaming them for any kind of outcome or trying to shame them into going to get the vaccine, that is not a tactic that will ever be effective in communities of color, right? Like thinking about building on this, people are doing it because they want to support their families, because they understand health. Giving them credit for the brilliance that is in all of our communities is really important.
Absolutely. Absolutely. So beautifully stated, and so appreciative again of the work that you've been doing for years, trying to bring light to racial inequities in maternal health and in infant mortality as well. And just so appreciate the narrative of, no, let's not blame the victim, right? Let's talk about what we need to do to be better. And so to that point, let's kind of shift into the next phase of this conversation. I want to turn us as a panel, and again, what a moment to have this beautiful panel of women of color reimagining what public health looks like for New York City. I mean, what a moment! I just want to highlight again how meaningful and important I think that is, because it's us standing up and saying we are the future, right? We have vision, we have dreams, we have strategies for liberation, right? And so let's let the world hear them. So along those lines, I want to actually go back to Dr. Martinez, who we started with. And Dr. Martinez, I'm wondering if you can tell us just a little bit about, again, a lot of your work is around infectious disease ecology. It's thinking about all of the systems that lead to inequitable infectious disease outcomes specifically. But we know that collective problems need shared solutions. So I'm wondering if you can tell us a little bit about how you think we can co-create an equitable COVID-19 recovery that's not just about experts, but that's about community and shifting power.
Yeah, absolutely. And I really am inspired by what Crystal Echohawk had mentioned about this listening campaign, right? Because I think that so much in public health historically and to date has essentially not asked communities, what do you want? What do you need? There hasn't been that listening component. And so instead of, making assumptions about what communities need, actually going out and being on the ground. One of the things that I've thought about is working ways. There are traditional ways that public health organizations have typically, worked with nonprofits and things, but, we need to really get more creative. And what about working with mutual aid groups, like people that are really, embedded in their communities? They are the individuals who are going and making food in their homes and taking them to senior citizens in NYCHA houses. And, we need to break out of this current shell that we have. But I would say that in terms of the systems thinking, that we have two major crises on our hands. We have, actually, even more than that. We have the crisis of white supremacy, which has been with us for a very long time. We have the pandemic, but we also have climate change. And they're also communities of color and people of lower socioeconomic status and means to adapt to things like extreme weather events are less capable of dealing with these hazards. And so I think that as we start to address the issue of the pandemic, we also need to think about what are other major issues facing our communities and how do we start addressing these vulnerabilities with like a bigger systems thinking and branching out, working with sectors that are not just public health. Because as I mentioned before, environmental racism, it's about our built environment, right? And so, we need to work with city planners and make sure that there's appropriate green spaces. We need to make sure that there are as many bicycle lanes in the Bronx as there is in, the financial district or in parts of Brooklyn. And so all of these things intersect. And I think we need to really dig deep to figure out all of the places they intersect.
Absolutely. Absolutely. I really want to lift up again and underline your call for working across agencies, across disciplines, across communities. That when we talk about the social determinants of health, I think especially, and I'm going to call out us doctors, right? It's all about like, okay, how can us doctors fix the social determinants? But we need to be working across disciplines, right? And recognize that we need the economists, we need the ecologists, we need the architects, right? We need the planners. So I really appreciate that point. And to that point again of kind of building capacity and power for change. The next question I'm going to ask is actually to two of the amazing panelists tonight. So this one's for both Crystal and for Dr. Joya. Can both of you have done incredible work around narrative power, narrative change? And I'm wondering if you can just speak a little bit about how you see opportunities going forward for building community power using narrative impact and narrative change. I don't know who wants to go first, but I suspect both of you have some ideas on that one.
Well, I'll go because I feel like Crystal's answer is going to be more robust. So I'll go first. So yes, we figured out long ago that if you think about it, policy changed to desegregate hospitals and desegregate schools in the 1960s. And yet, if you walk into any hospital, especially in New York City, or into any school, they're just as segregated as they were, or sometimes even more so than they were when we legally desegregated. So as long as the narrative is that communities of color are broken, as long as the narrative is that our job, that we are not fixable, that we come with innate problems and issues, and we must be set aside, and you cannot be together or be in charge or be seen as leaders. As long as that's the underlying message, that there's a devaluation of people based upon skin color, a hierarchy of human value based upon skin color, then we're not going to be able to move forward, right? No matter what policy, you can put together a beautiful policy about health. You can put together a beautiful policy that we're going to, and we see it. You can have a policy that says we're going to vaccinate the most needy first. But then you see those who don't value the most needy taking over and taking those vaccines from the communities who they know actually needed more, because they don't value those communities at all. So how do we make the narrative be one that the least of these is as important, right? The overriding American narrative has been survival of the fittest. And it turns out when they said fit, they meant land-owning white men. Well, that leaves a lot of people. So how do we change that narrative to really investing in communities of color, and really knowing that we are amazing and awesome and we're valuable? And when you skip over us, or when you take from us, and when you hoard power and wealth and say we're deserving of it and you are not, then that is a problem. So that's the narrative that we need to change.
Absolutely.
That's a tough act to follow. I mean, yes, plus. You know, and it is so much. I mean, you know, the greatest narratives we're fighting against is that we are not human. We are invisible. We are less than human. I've been watching the Derek Chauvin trial, and it just really has struck me so much about these dominant narratives that are used, weaponized against our communities, right? And we see that. So I think, you know, there's a couple things, like, you know, again, you said it so eloquently, you know, these narratives about our broken communities. And that's what we saw during COVID, for example, right? Everybody wanted to talk about Navajo Nation. They have no running water and they're so pitiful. They're this, they're that. And nobody wanted to say, you know what? Navajo people got up and they self-organized because the government wasn't coming and to take care of their own, right? And Indian country organized to get resources. And so when we think about opportunities around narrative, there's a couple different things. We need to continuously dismantle these dominant narratives, right, pushed by white supremacy that impact our people, resources, you know, all of the things that were just outlined. But I think we also need to understand the impact that those narratives have on our own people, right? So as much as when we think about the power of narrative, we need to be telling stories about how we are addressing this within our communities, because our communities are self-organizing. We are taking care of our own. We're trying to find those solutions. We need to be uplifting those stories of our leadership, our resilience, our absolute innovation, because we are constantly faced with the lack of access to resources and other things that we need for our people. And so it's just as much as it's about, you know, speaking truth to power, our own communities need to be hearing our own stories about how we are combating this, and that we are worthy, we are deserving, right, to have access to health. And I think that's incredibly important. We both have to fight right against those dominant narratives, but we also really have to have our people hearing that. And I think we also have to be hearing that from other communities of color. We need to be really in this moment, seeing each other, hearing about our experiences through the pandemic. And this is the time that we really need to be linking arms and really doing this together.
Absolutely. This is a moment for global solidarity, for national solidarity, for solidarity across communities of color. I super appreciate that. I want to turn next to Laura Stiles again. And Laura, I feel like you've done such a great job for reminding us that we need information to be accessible, right? We need information to be easy to find, totally accessible in every language possible. And this information needs to be extremely reliable. But I think another error that us doctors and health workers in general often commit is that we speak in tongues, we speak in languages that make no sense. We really often struggle to be able to communicate effectively. And so I'm wondering if you can share any thoughts you have about what health workers can do to be more both trustworthy and easy to communicate with. How can we get out of our expert identity and really be accessible to answer any question, no matter the flavor, in a way that actually makes sense to folks who haven't spent too many years in school?
Right. So I'm listening to Crystal speak, and I agree with her so much. This is a time where I feel like all of us need to be listening to all of our sisters and brothers, right? To see how the layers of what we're going through, to Dr. Tony's point, like we're going through so much. So we're constantly listening and constantly learning, right? But one thing also that I think it's very important, we have to listen to our young people. A lot of times our young people are the ones who are bringing the information to their parents. We're talking about parents that work 2-3 jobs, that barely make it home in time for dinner. You know what I mean? Who don't have the time to be on social media or to attend an incredible panel like this one virtually, And the reality is that there are so many men and women here in New York City in order to survive. We are working 2-3 jobs, right? And when I say we can't forget about our young people, I mean, like, we should be reaching out to platforms that our young people frequent. You know what I mean? And listen, and this is why I've taken it, not only myself, Ebro and Rosenberg, we've taken it upon us as our responsibility to not only interview what Cardi B, you know what I mean, or 50 Cent and whatever, Issa Rae, because Insecure is popping and the last season is coming. But hey, you know what I mean, we're also going to have community leaders come on board to talk to the same audience so they can hear how important it is. Like when Dr. Joya was speaking about the mortality rates with Black women, I turned around and I was like, oh, okay, this is information that I'm interested in. You know what I mean? And this is information that so many people of color need to hear. And there's these bits and pieces of information that these young people are like, whoa, wait a second. I never even knew this was a real thing. You know what I mean? So sometimes I think, we get caught up in our social groups, but it's important not to forget the young people. And I think by kind of simplifying and speaking the same language as our youth, and also reaching out to our youth leaders, because there's a lot of incredibly talented young people that care about their communities, that are out there, that make me so proud, because I'm like, you know what, our next generation is going to be okay. My baby, I have my daughter just turned 5 months, and I look at her like she's going to be okay because of the young people that are so vibrant, intelligent, and are seeking to make change. But they're looking at women like yourselves, and you guys are changing the conversation. Now we just have to get these bits of information to them to help them amplify their voices, you know what I mean, and deliver the information to their parents who maybe don't speak the language, who just don't have the time. So I think that, whether it's through fun social media, you know what I mean, to reaching out to platforms that are moving in the social justice space, that are cool, that all the young people kind of frequent, you know what I mean? The music platforms, because believe it or not, in every single platform, there's women of color behind making it run, making it work. And I know all of them want to have this conversation because it's just as important to us and our family.
Absolutely. Absolutely. This is personal, right? This is about community, and it's also personal for us. Absolutely. Absolutely. Well, we're going to be turning to the questions that you all submitted online prior to the event and actually live during the event in just a second. But just before we bring in some of your questions, I'm going to ask one last question, Dr. L. Tony Lewis, because it feels like we are kind of in this world of like self-care, take a bath, do a yoga class, or like, we kind of we're in a little bit of a self-care rut in a way. And I've heard you speak about collective care, collective wellness, taking us out of that individualistic approach to healing, resilience, and into a collective care kind of framework for that. So how can we do that? How can we do that even more going forward? How can we get out of the individualistic approach and into a collective care and resilience approach?
And let's be clear, I'm a fan of the individual and the collective and the community and the societal and the globe. Like, let's do a global healing circle and get it in, and let's invite Issa and all the artists in New York and the whole nine. I mean, that's why D-Nice had 500,000 people, kind of dancing through. And so this is one of those things where I was super excited to hear, about bringing in the young people's voices. And I don't know, I hope we all hear about listening. I feel like we could just put a banner across it. We just need to listen more. We need to listen more and listen for real. So one of the biggest, oldest tools, kind of ancestral tools to futuristic, Afrofuturist kind of thing is the idea of the collective circle. Just kind of sitting together, whether it's for healing or the sister circle to share tools and recipes, or the intergenerational circle where you've got the young folks can have the mic as much as the elders, as much as the organizers in the middle. But just finding those ways where we're both operationalizing circles like we're doing, like Liberation Health Strategies is doing in multiple places around the country and in Brownsville and, in the globe, to kind of just put people together where people can just say what it is you need, what's working for you. And, if you've got an Abby that can sing, if you've got a Carla Gaskins Nathan that can lead you through kind of a self-care massage, if you've got someone who can drop in a meditation, or if you just take 5 minutes to breathe together, that can be a thing. But the really important part about this, I think, is to understand that self-care, wellness, healing have not always been afforded to us meaning people that look like all of us on the panel. And so an equity approach means putting that in the center, whether it's giving people more time off who are BIPOC because they're carrying a heavier burden, whether that means taking 10 or 15 minutes off of your meeting, or signing up with the NAP ministry. Those are just, we need that extra rest, because the rest and the healing that is needed to attend to our wounds is really serious. The last thing that I want to add about the importance of the circle in the context of everything we're talking about is, when we talk about deep listening in terms of what folks need, in terms of what we want, in terms of how we're suffering, the deep listening that can come from those spaces, from those circles, from our brilliance are the solutions as well. And I think that's one of the things, one of the big narratives that's missing. I've been studying public health since 92, since I was in college, and that shame narrative that Dr. Joya talked about and what everyone's talked about is so serious, but also this narrative that folks don't inherently know what they need. Look, we got brilliance in Brooklyn. We got brilliance on the reservations. And I can tell you, before Dr. Fauci or anybody said anything about variants, the healers, the aunties, the organizers in the neighborhood knew something was popping, knew something was going on with symptoms. The healers in the health food store knew the oregano oil was flying off the shelves. The grocery stores knew the ginger was going someplace. You know what I'm saying? And we knew from our face, the clergymen knew that their parishioners weren't showing up for, so we know. So I think normalizing that there's a brilliance that exists. And I think at Liberation, we call it neighborhood epidemiology or hood epidemiology, hood epi, farming that as how public health can kind of really deeply listen to learn and to innovate, because with COVID and everything else, we ain't got time to wait for a man in a white coat to validate our suffering or our solutions. Like, public health needs to get on that like now, and that's our life or death daily choice to innovate.
Absolutely. Absolutely. I believe in that future. That's beautifully said. Thank you for that. And now we have a few minutes to kind of jump in with some of the questions that you all in the audience submitted. And again, thank you for the beautiful, powerful questions. There are many. We're not going to be able to get to all of them, of course, but we're going to try our best to delve in. Because we know that a lot of the folks that have tuned in tonight came because they actually want a reliable source of information or response to a question they have about the vaccine, or about inequity in their community and how it could be better addressed, or about, again, what the future of public health could look like. So I'm going to ask this question. We have amazing panelists. So I know all of you are going to have opinions, but no pressure for everybody to necessarily answer each question. So there's a really great question about how the public health department, our city public health department, can do better to address cultural diversity issues as we're working on more equitable and healthier New York City. So any recommendations for us, best practices for us to consider, again, around really getting at language literacy, diversity? How can we do better?
Well, I will say one thing with the Department of Health, even though there are amazing people there, and I really love the fact that there's this whole equitable COVID response mandate that's been put out has really thoughtful language. But I think being very transparent about the situation and the failings. As I was saying, some of the hardest hit communities still have some of the lowest vaccination coverage. And I think in building trustworthiness, organizations really need to say, well, what is it going to make us trustworthy? And I think being trustworthy, some of that is really owning up to the failures, even though they might have good intentions of doing and are doing hopefully the best that they can, but saying where we need to do better. I think that that's a major thing for building trust. And yeah, it even happens when, one-on-one relationships with friends, you say like, oh, I really messed up here. Like, let's have a conversation about this. And that allows you to be able to move forward.
Absolutely. So again, beautifully stated, and how important that acknowledgement is, right? Because otherwise, it's folks want to know that that there are areas for improvement. Absolutely, I think that's very clearly stated. We have a question from the audience from someone who says, "I'm 5 years vaccine, but I have a fear that it'll make me sick, and I'm worried about whether or not it's truly safe and what effects might have." So anybody want to jump in on that one?
Yep. Sorry to keep talking. I'm happy to jump in on that. So I'll say I don't really like the word safety when it comes to vaccinations, because I think that this might put an image in people's minds that a vaccine can do no harm. And that's just not the case. With every vaccine, there are risks of adverse reactions to the vaccine, and then there are benefits to that vaccine. And it's the countering of those two that makes not only vaccine licensing and emergency use, that's what allows vaccines to be deployed to the public, but also should come in when a person is making the personal decision of whether or not to take the vaccine. So in the United States, we have 3 vaccines that have emergency use authorization by the FDA, and they all differ in terms of what adverse events were found during the clinical trials. Now, for the 2 that are being used most widely right now in New York, the Moderna and the Pfizer vaccine, the most common side effects have been essentially really severe allergic reactions. And those tend to be in people that have allergies. And so this is one of the reasons why that when you go and get the COVID vaccine, they're going to make you wait 15 minutes to make sure you don't have an allergic reaction. Because if you do, you might have to get a shot of epinephrine to make sure you don't go, into anaphylactic shock. So all of that is to say, there are these types of reactions that can happen. And for each vaccine, it differs in terms of the numbers for the adverse events in, whether they're 1 in every several thousand or 1 in every million. They're different adverse events, but you have to counter that with the fact that 1 in every 1,000 Americans have died from COVID. And so it's this cost benefits ratio, which makes it so that getting the COVID vaccine, there's no guarantee there will be no harm done. But your best bet is to get vaccinated. That is the safer option. And then not only for yourself, but also for the people in your community.
Thank you for that. And again, it keeps coming up, right? It's like the risks, the benefits, and the alternatives, and only, each person has to be able to make that decision for themselves. And thank you, Dr. Martinez, for really highlighting, again, that there's nothing that's zero risk, right? And yet there are some clear, powerful community and individual reasons to go ahead and get the vaccine if you feel comfortable. There's another great question that's come in from the audience. This is a question that honestly I'm excited about this. I can't wait to see what you all respond to this question with. But this person's asking, what can individuals do to promote vaccine equity and vaccination, which I think is such a great question, right? We're talking a lot about systems and community power, and all of that is important. But this person's asking, what can individuals do?
Well, I'll take a stab at it, because I do think there is an important thing to think about. When I mentioned the part about people are hoarding, like individuals can talk to their family members about who should be getting the vaccine first, like really acknowledging that there are people and holding accountable. If you have friends and family members, or you want to work for vaccine equity, if you want to help us in public health, help us by talking to your family members and say, hey, we need grandma to go, but you right now, it's not your turn yet. Like really ensuring that we are I think a lot of times we don't hold people who have power and wealth accountable for their actions. And many of you know people who have power and wealth, and you don't have those conversations with your cousins, your sisters, your friend's boyfriend who went up downtown to get a vaccine that he shouldn't have gotten. So you can help us by doing that individual accountability.
I love it. Absolutely. I think I saw Laura wanting to go for it.
Yeah, I was just going to jump in real quick. I think what's been working for me is it's just kind of echoing a lot of the conversations that we had today, sharing bits and pieces of information that helped me and make my personal choice. So I know vaccination is a very, very, personal choice, and not everyone likes to talk about it. And I was actually really surprised how many people don't want to share if they want to get vaccinated or not, because they're scared of, getting shamed, or they're scared of having but what if, you know what I mean? And the sharing of all these this person died here, and this person, skin melted off, or whatever craziness is going on the internet, right? But I found it interesting for me that I've been sharing my story on why I decided to get vaccinated, right? I've had friends of mine that were very healthy and ended up passing away from this horrible disease, and I've had friends of mine who just had nothing, not one symptom. And I know all of you guys have seen it all, right? From from the least to the worst. But to me, I just know that watching my friends in the hospital for weeks at a time, I know that I'm not built for that. And I know that I did not want to be hospitalized, and I don't want to die, and it's like, and, with it affecting everyone so differently, I just didn't want to gamble with my life. And I've been vaccinated for other things. So I just decided to seek for more information. And I just encourage everybody to attend panels like this one, where you can ask the questions, where you can be honest about your decisions. And I know, like I said, I know it's very personal to share your choice, but it's specifically for your abuelitas, your parents that don't speak the language. It's important to talk to them and to seek information and to look up whenever they have any, any questions, and just give them facts, and make sure you're going to the right websites, and you're looking for the right information from the right people, because there's a lot of fake information out there that, just because you see something salacious on the Instagram post, people are so quick to share that stuff, but I was like, I think sharing bits of information like all you ladies shared today is way more important, and more than ever right now.
Amazing. Thank you for that.
Dr.
Oh, go ahead, Dr. Lewis. Go for it.
Yeah, no, I would love to add a challenge to our colleagues in public health and healthcare to disrupt the shaming. So I want to say I love the way Dr. Martinez laid out the truth, the full truth, and we should normalize listening and the ability for a person to ask a question about what's going in their body. Like, I am so annoyed by the whole getting shots in arms thing, because that just feels very abusive to me. And as a person with a history of domestic violence, like, you don't need to talk to me about me just trying to get shots in arms. But like, when we see our colleagues trying to like say, oh, y'all are stupid, Tuskegee was da 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 da, or y'all just need to get the shot. Like, we need to disrupt that and normalize folks having autonomy and real truthful conversations, which include the fact that like we've got some uncomfortable truths, and not all of our colleagues love our people the way we do on this panel.
Right.
And so we need to call that out and be like, look, I know your last 8 months saw you getting denied vaccine, getting denied tests, turned away from hospitals, and we deserve all the things. We deserve all the things. So let's go get it. But I want to challenge our professional folks to like just disrupt that stuff wherever you see it and say, nope, everybody deserves to have this conversation in a respectful way that gets truth, because it's life and death here.
That's right. That's right. Absolutely. Absolutely. Again, like, just so blown away by all of you, by each and every one of you. And the thing is, right, like, all of you have been doing this for a long time, and it's really amazing, I think, to be able to capture your wisdom, the pearls, the vision, your guidance. You're not new to this fight, and that came through so clearly in everyone's comments. We're coming down to our final minute, so I'm going to ask each panelist to just share one kind of final thought for this kind of closing question here in 30 seconds or less, so that we can end as close to on time as we can. So we've been talking a lot, of course, about racial justice, about social justice, about health equity, about community power, about the future of public health in New York City. So if you could pick one thing to reimagine for the future of public health for New York City, what would that one thing be? And I'm gonna actually just ask Michaela to start us off, and we can kind of go through the panel. Just one final imagining thought.
Yeah, I would say the thing that's most been on my mind, and not just within public health, but I would say more generally, is that communities of color have not always been linked together in ARM. And, I would love to see the Latinx community, the Asian American community, the Black community, the Alaska Native community, and Native American community. We've all had different means of oppression, both historically and today, and to actually really be able to move forward with like collective power, saying like, we see what all these institutions are, and like, we have a huge amount of collective power that has been, purposefully kind of kept us in isolation from one another over the last, several hundred years. And so I that's what I would like to see in the future.
Amazing. Lara, do you want to go next?
Sure. I guess, I guess what I would like to see is I would like to see us uplift our youth, as I mentioned before. I really want us to uplift our youth a lot more, especially the ones that are very passionate, that are going to be the next doctors, the next, the activists that are on the ground right now, and amplify their voices and give them whatever knowledge that our generation has, pass it down so they can pass it over to their parents, to their grandparents. I think it's really important. The more I speak to our youth through social media or through our shows, that's the one thing that a lot of them, are always saying, like, I wish someone would listen. You know what I mean? I wish I could, find there's a place where I could really truly understand certain things. So I think that it's our job to find creative ways to reach our youth with the information that we do have, but also it is our job to empower them. And the voices that are dedicated right now for change in our communities, I think it is our duty to uplift them and to push them, because those are the ones that are going to create the change for our future.
Amen. Amen. Absolutely. All right. How about you, Dr. Lewis?
So piggybacking on the listening and creativity in our youth, I think to reimagine public health for NYC, we need to normalize and appreciate and protect and invest in the brilliance that already exists in our community. To be clear, protect and invest in that, and acknowledge that brilliance, not just as resilience, like, ooh, you got over the harm, that's great. No. On the front end, the brilliance to co-create a future that's about like joy and liberation. I mean, I want to see dancing in the streets of my people, not just numbers from 1.8 to 1 death. You know what I'm saying? So like, let's normalize that brilliance in co-creating the future, and public health being about the public creating health that's like liberation focused.
Beautiful, beautiful. Some of us are taking notes. I hope you all realize that. Like we know that equity can sometimes be a hashtag, but we're actually planning to build on what you're telling us tonight and use it going forward. So thank you for that, Crystal.
Yeah, just to build on all the brilliant things that the women are saying tonight. I mean, I think to really just, again, center, voices in communities of color and appreciate our diversity. None of us are a monolith, right? When I think of Indigenous population in New York, it's not just Alaska Native and Native. You've got a lot of Indigenous people from outside the United States as well. And so I just think it's really that intentionality, and it requires extra work. But if we're going to really, really build an equitable future, if we're really going to recover and all these things we talk about, we really have to be centering communities of color and appreciating that diversity and the gifts we bring and the solutions that can be created. And that, I think the final thing I would say is we've talked a lot about narrative tonight, and narrative is powerful, but narrative is only truly powerful when it connects with organizing and direct action. And so just to really constantly understand that that's an important part of the equation.
Absolutely. Absolutely. Okay, great. So Dr. Joya, close us out.
Yeah, so I'm a little bit of a public health nerd. I love public health, and I love the origin story of public health. It started off as an organizing strategy. I mean, the original people who did public health were fighting for children not to have child labor, for clean water and clean sewage. And when you think about what it evolved to, right? Most of us are going into restaurants, policing the food in the restaurants, policing children, taking social services and removing children from homes. That's not the original origin story, right? So let's reimagine and go back to what we were supposed to be, which was about justice, which is about joy, which is about really investing in and working with community. That's what public health is supposed to be. So for New York City to see itself as an organizing tool for the people, not as a policing of the people, and not as a controlling of the people, but actually organizing and supporting and following the people's lead, because they actually have been doing the organizing without you. So following them, giving them the resource to actually continue to do the organizing they've been doing.
Incredible. I can't think of a better final word. And I just can't thank all of you enough. Dr. Martinez, Laura, Dr. Lewis, Crystal, Dr. Joya, thank you for spending your evening with us, for kicking off this series, for this, again, final day of Women's History Month, for Trans Visibility Month. for all of our communities that we're in solidarity with, especially the Asian American Pacific Islander community right now. Just so thankful for all of you, for the brilliance, for the wisdom. And I'm going to turn it over to Dr. Torian Easterling to close us out and set us up for our next session in the series. Thank you. You're on mute. It had to happen at least once. That's so weird. We still can't hear you.
No. Oh.
I don't know what happened. It's the women's history. Let's see if that worked. No, it's definitely the gods of Women's History Month. That's I don't know.
Down with patriarchy. Down with patriarchy.
So Victoria really have some important things to say.
We love you.
It's like, what, Dr. Tori? What are you saying? What?
Oh my goodness. Well, I'm not sure how we should manage this one, honestly. I don't know if the techniques are working on it. Could we could certainly open it up for one more question, or I'm not sure. You all tell me. I guess I can. Should I just close this out?
Sure.
Okay, I think I will just close this out then, and say that, and if Torian jumps back in, amazing, and if not, Torian is actually going to be moderating the next session in the series, which is on April the 27th, and we hope to see many of you there, same time, 6 p.m. We're going to be talking more again about your guidance from all of you, and guidance from experts like the incredible women of color on the panel tonight, about how we can continue to do this work of reimagining, seeing ourselves to the other side of this pandemic, and moving forward from here. So it's about, collective recovery. It's about certainly resilience. It's about a path forward for New York City. And so we hope to see all of you there again on Tuesday, April the 27th at 6 p.m. Oh, I think Torian's back.
Yeah, can you hear me?
Yes.
Well, I won't take up too much more time, and certainly I'm okay if I'm pushed out and I don't need to be in the space. But I just want to say really quickly that this has been amazing and inspiring as we've been thinking about sort of reimagining what public health could look like. But it's just, we understand that there's tension and there's struggle, but this conversation really just reignites this feeling that we can certainly win and we can get there. So first, let me just thank our amazing panelists, Dr. Martinez, Laura Stiles, Dr. L. Tony Lewis, Crystal Echo Hawk, and Dr. Joy Career-Perry, for your insight and your wisdom. Really just grateful for the work that you all do, and certainly just I'm honored that you are here to help us launch this amazing series. And certainly thank you to all those who participated far and wide, because it's not just thinking about locally, but certainly this is both a domestic and an international struggle that we have to do together. And to the amazing Dr. Michelle Morris, who I have the honor of now calling a colleague and a friend. And so just thank you so much for your leadership and facilitation. And as you've already heard from Dr. Morris, this is a series. We are continuing. We will be back on the 27th at 6 p.m., centering the conversation about collective recovery and civic wellness. We are the answers. The answers are certainly in the community, and you heard that tonight. But I will not delay any longer. But I do want to thank everyone again, and just one more ask. There is a post-event survey, and really would ask that you all complete the survey. We want to hear from you, continue to hear from you, and we want to learn and get better with this production. So thank you again, and thank you for joining us, and thank you to our panelists and to our facilitator. Good night.